Hi, everyone. I'm going to give just a little bit of time for everyone to join before we get started. Alrighty, we're going to go ahead. My name's Jenna Hurley. I'm one of the PAs that works here at Advanced Urology Institute in Panama City, Florida. I promise that picture is me, even though I don't look like that in my webinar video now. Drastically changed my hair since I first started working here. I graduated from the University of Illinois, Springfield, for my bachelor's in biology. I went to St. Louis University for my master's of medical science and graduated in 2019. Since then, I have had the opportunity and pleasure to work here at the urology office in Panama City. It's been a wonderful experience. I have really enjoyed it. I've been able to subspecialize in women's care, which I'm really passionate about, along with treating a lot of other common urologic issues like uh, BPH, prostatitis, overactive bladder, interstitial cystitis, urinary urgency, those types of things. But it's been really wonderful. I've really enjoyed it. So tonight's talk is going to be about hormone replacement therapy for women. This is a little bit far and few between with a lot of other providers, including primary care doctors and gynecology, sometimes endocrinology. But it is true that for us ladies, our hormones change over time and especially bottom out around the menopausal area. There are a lot of different signs of hormone imbalance, not only sex hormones with menopause, but also thyroid hormone imbalance and other adrenal hormone imbalances. Those can include the following: fatigue, difficulty sleeping, hot flashes, decreased libido or sexual desire, reduced mental focus, mood swings, and weight gain or loss of muscle mass. So, what is hormone replacement therapy? It helps to treat symptoms of menopause. Some of the more common ones are vaginal dryness and hot flashes, like we just mentioned. Hormone replacement therapy from a sex hormone perspective, which is what we're mostly going on tonight, replenishes the ovarian hormones, such as estrogen, progesterone, and also testosterone, which can decrease during the menopausal or premenopausal transition. It alleviates associated symptoms, like I said, especially hot flashes and night sweats, which are one of the most irritating symptoms associated with menopause. Hormone replacement therapy comes in many forms. The three main hormones, like I mentioned, are estrogen, progesterone, and testosterone. There's a misnomer that women do not need testosterone replacement or do not benefit from it. Thought that it is a uh, man's or a men's hormone only. That's really not the case. Women have testosterone. A decrease in testosterone can cause a lot of the symptoms that we've already discussed. Estrogen has lots of different formulations that can be provided for different types of application. There are tablets, patches, gels, sprays, or implants. Progesterone can be taken as a pill, a patch, a vaginal cream, a vaginal suppository, or an IUD. And testosterone can be applied as an injection, a gel, a patch, or a pellet. The type of hormone replacement depends on the different symptoms. If patients are having more localized symptoms, we use local hormone replacement a lot of times. That includes vaginal rings, creams, and tablets, which can help a lot with vaginal dryness and pain with intercourse, especially in that perimenopausal or menopausal era. There are also pills and patches, which can help with those more systemic symptoms that we talked about, like night sweats. So, who can benefit from hormone replacement therapy? There's been a lot of talk about the safety and efficacy of hormone replacement therapy in varying age categories. Women can take hormone replacement therapy if they have menopausal symptoms, including during perimenopause, which is after their period ceases, but before that 1 year mark, indicating full menopause. Menopause usually affects women between the ages of 45 and 55, but the onset can happen a lot earlier, and it affects anyone who has periods. So we talked a little bit more about the different types of hormones that can affect all the different symptoms that we can have, not only sex hormones, but also thyroid hormones and adrenal hormones. The hormone imbalances in general can cause fatigue, sleep difficulties like difficulty falling asleep or staying asleep. It can lead to weight gain and decreased metabolism, brain fog or difficulty concentrating, decreased sexual performance, pain with intercourse, vaginal dryness, low mood, or anxiety and depression. Thyroid hormones can contribute to some similar symptoms, including fatigue, poor concentration, dry skin, constipation, feeling cold, fluid retention, and muscle aches. Having a hysterectomy, which will change your ovarian hormones, especially if you have a total abdominal hysterectomy, can lead to hot flashes, night sweats, light bleeding and discharge, and vaginal dryness. Metabolic syndrome, which is more correlated with your hormones of the adrenal glands, can lead to increased blood pressure, elevated blood sugar, and obesity over time. So hormone replacement and menopausal treatment can be taken care of in several different ways. Going ahead and replacing the hormones is one medical option that is an option for many different women, but there are alternative treatments that I like to discuss with women that are a little bit more conservative. The lifestyle changes for women can make a big difference. Making sure that you're exercising regularly with weight-bearing exercise will keep your bones strong. A balanced diet can help with weight gain and menopausal changes like decreased or difficulty with sleeping. And prioritizing sleep can help with mood, stress, and other issues. Antidepressants are non-hormonal and can help with some severe symptoms like hot flashes and insomnia. There are also other medications that can help with overactive bladder changes, including irritative voiding symptoms like burning, frequency, urgency, and incontinence can all be associated with menopause as well. If patients are having difficulty with vaginal dryness or painful intercourse and do not want to jump right to hormonal replacement, we can try vaginal lubricants and moisturizers. There are lots of different kinds, and making sure you use the appropriate kind will help with symptoms more than just picking up any lubricant off of the shelf at Walmart. Osphena is a pill that you can take to help with painful intercourse that is non-hormonal as well. Also, relaxation techniques have been shown to help with some of these symptoms, including meditation, yoga, hypnosis, and acupuncture. These can help with hot flashes, memory dysfunction, a brain fog, and sleep deprivation. When choosing a treatment, we want to consider your medical history, your current medications, and the type of symptoms and their severity and duration to make sure that our treatment plan is appropriate for you. The main benefit of hormone replacement is that it can help with most menopausal symptoms as a whole, though, like I said, we do sometimes target specific symptom profiles if those are the most bothersome to patients and they want to avoid hormone replacement. It can also help prevent osteoporosis over time by keeping your bones strong. So for diagnosis of a hormonal imbalance, there is not a single inclusive test that checks for this. We do have several different diagnoses or diagnosis modalities that we can use to fully evaluate patients for their appropriate treatment with hormone replacement. This includes a symptom profile check, diagnostic tests, and at times a medical exam, depending on symptom profiles. There are blood tests that we use to measure hormone levels, and that is a basic starting point for hormone replacement. Ultrasound can check for uterine abnormalities, ovarian abnormalities. We can also use that to screen your thyroid and pituitary gland, which can contribute to hormone dysfunction. Pelvic exams are necessary if patients have vaginal or vulvar complaints, pain with intercourse, that sort of thing. And sometimes other tests like diagnostic tests, including MRI, biopsies, or other specialized scans may be indicated. So there are some risks with hormone replacement therapy. One of the big ones that patients are concerned about is the risk of breast cancer. There was a study back in the early 2000s that showed that there was an increased risk of breast cancer with hormone replacement therapy, and a lot of patients were taken off of it because of that. There's been a lot of new studies that are delineating risk of hormone replacement as far as risk of breast cancer goes. And the sooner you can start hormone replacement after symptom presentation, the less likely the risk of breast cancer. Of course, the older the patient is, up into the late 60s and 70s, there's already an increased risk of breast cancer, and this can become a little bit more prevalent with hormone replacement. So it's something important that I talk with patients about regarding their history, if they have a family history of breast cancer, if they've had regular mammograms, that sort of thing. Heart disease. So there is also, in that same study, there showed that there was an increased risk of heart disease. Again, in the younger patient profile, if patients are getting treatment earlier at the onset of symptoms, heart disease has a smaller prevalence of risk. And actually, there are some studies that show a degree of risk reduction if you start hormone replacement early, as far as heart disease goes and cardiovascular side effects. Osteoporosis can become prevalent, especially if you stop hormone replacement. Osteoporosis is one of the things that is treated most drastically with hormone replacement to keep our bones strong and to reduce the risk of fracture. However, if you have been on hormone replacement and you stop it, we need to make sure that you're being screened regularly for osteoporosis. Long-term use of combined hormone replacement or singular modality hormone replacement can increase the risk of pulmonary embolism, which is a blood clot in your lung, or possibly blood clots in your extremities, specifically your lower extremities. It has been shown that using transdermal or creams or patch type modalities of estrogen or other hormones may be safer for women who are at higher risk of blood clot or higher risk of heart disease. There are some people who are not candidates for hormone replacement therapy. If you've had a recent blood clot, heart attack, stroke, or angina, which is the medical term for heart pain or chest pain, you should not be started on hormone replacement therapy. If you have a rare inherited condition called porphyria, that is high risk and you are likely not a candidate for hormone replacement therapy. If you're pregnant or breastfeeding, we obviously do not augment hormones during that period. If you've had breast cancer or have been, if you've had treated breast cancer, or if you are at a risk of breast cancer, I talk with patients about that. And I also talk about patients about the risks if you've had epilepsy or strokes and seizures. So the benefits of hormone replacement are very wide. There's a lot of benefit regarding sexual wellness. When you have a decrease in estrogen, it can lead to thinning and dryness of the vaginal tissue, which can result in discomfort and pain during sex. That can then reduce your libido. Balancing those hormones can often resolve those issues and increase a patient's satisfaction with their sex life. Mood improvement, mood swings, irritability, anxiety, depression, these are all common during the menopausal or perimenopausal era. And hormone replacement therapy has been shown to treat these emotional swings and help regulate patients' moods. Energy boosting, a lot of patients have a stark decrease in their energy during menopause, and hormone replacement can even this out for patients. I have a lot of patients after starting hormones that are feeling more chipper every day, and they're feeling like they can get out there and do their exercises and make it through the day without feeling sleepy or tired. Memory improvement, women experiencing brain fog or issues with memory have seen improvement after regulating hormones. Anxiety and depression, we talked about this a little bit. Hormone therapy patients tend to report relief of these symptoms, though it's not always a quick symptom reduction. A lot of times it takes 3 to 6 months. So there are lots of different types of treatments when it comes to hormone replacement. There is estrogen-only hormone replacement, which is only for women who no longer have a uterus, so typically after hysterectomy. You can also have combined hormone replacement with estrogen and progesterone for patients who have not had a hysterectomy and have their uterus still. Testosterone can be implemented with either of those modalities as well to help improve symptom profiles. So there are tablets that can be taken. There are patches that can be applied to the skin to absorb hormone transdermally. Usually we do that on parts of the skin that have less hair, so in the upper arm, hip, upper leg, sometimes the calf. There are gels that can be applied. There are sprays, though those aren't used very commonly, and I don't use them very commonly, but they do exist. And then there are also vaginal creams, tablets, and rings, as I discussed previously, for more local vaginal therapy if patients are having dryness or pain with intercourse. Pellets are a modality that can be inserted under the patient's skin. When we do that, the body forms a small bed of capillaries around the pellets, and the hormone is wicked directly into the bloodstream as your heart beats. And then intrauterine devices such as Mirena, or another one is called Kyleena, can be inserted directly into the uterus to slowly release progesterone. I do not personally do that here in my office, but I have a lot of colleagues in gynecology who do that, and we could certainly get patients referred if we need to. So I wanted to touch a little bit on why I think it is important to consider coming to the urologist or one of your regular medical providers for this information instead of some of these medical spas that have been popping up. I have had lots of patients come to me after being seen at a medical spa, and they were not evaluated appropriately. Their monitoring for their hormone replacement wasn't done at appropriate time intervals, and I've had some patients have some side effects because of that. We make sure to treat every woman uniquely, and we make sure that the treatment profiles are appropriate and suit your symptom profile without high risk of side effect. As I said, there's some limited knowledge at some of these medical spas. They offer hormone replacement, but staff may not be trained the same way we are in an established medical facility. The training of the provider may not be quite the same as someone who specializes in this, and it can lead to inappropriate diagnoses and inappropriate treatment plans at times. Many of these spas also prioritize aesthetics, which there's certainly a place for that, and we all love our aesthetics, some of us, but that's not always the best place to also be getting systemic hormone replacement when the side effect profile, as we discussed previously, can be significant. And as I said, sometimes the follow-up is not what I would recommend or what I would deem safe or responsible when it comes to hormone replacement from a systemic perspective. I'm really thankful that you all came to my talk. My name's Jenna Hurley again, and this is my colleague Stephanie DeRuin. She works over in Tallahassee and does hormone replacement over there. I am happy to take questions if you have any questions at this point, and I would be happy to try to answer them to the best of my ability. I think in a moment we will also be showing a link on the page here, so you can set up an appointment with me if you'd like, if you're in the area, or an appointment with Stephanie if you're closer to Tallahassee. So if anybody has any questions, I would be happy to review them and try to answer them to the best of my ability. Okay, so I do have one question here. And it asks if I can explain the costs to start a hormone replacement therapy at Advanced Urology Institute, and if I also offer compounded weight management injections like uh, Ozempic or Mounjaro. So the cost for hormone replacement varies depending on the type of replacement that we decide to use. There are certain types of hormone replacement for women that are not covered by insurance. We are working to get that changed as a medical community on the whole. A lot of male hormone replacement is covered, and there is a lot of lobbying going on to get that changed over time. Some of the hormone replacement, such as estrogen pills and progesterone pills, those tend to be covered. Sometimes the patches will be covered. There are a lot of good coupons we can use for the patches. Some of the modalities are not covered by insurance and they can vary in cost. So some compounded creams that I use, I have compounded at a local pharmacy called RX Express. Those usually run about, maybe $40 or $50 a month. And then we do offer pellets as well. Those are not covered by insurance for women. They only need to be inserted every 3 or 4 months for women. And the cash cost for that at our office is $350. I don't currently offer generic Mounjaro or any of those injectable medications for weight loss. Having hormone replacement on board can help motivate patients to be more active during the day in the gym, working on their diet, and that can help with weight concerns as well. But I don't currently offer that here. Oh, I'm so sorry. The lights here in my office went off. I apologize about that. They're motion censored. Okay. I have another question. So this patient said, I'm 68 and didn't get symptoms until last year. I guess my options are very limited, in part because I'm non-ambulatory and it's difficult to insert a hormonal ring. So there are different options that are better for some patients than others. Being age 68, especially if that's when your symptoms started, does not necessarily mean that your options are limited. I would be happy to discuss anything more specific to your case after learning more about your medical background, but there are a lot of options. The hormonal ring is not the only option, and I think that we could find something that would work for you. Here's another question that says, how long does it take to feel better and how long do you need to stay on it? So hormone replacement therapy, I tell patients if you're tolerating it well without side effect, to try to hang in there for 3 to 6 months. 6 months is really when we know if it's helping patients or not. If you're not having side effects, that's usually how long I continue the therapy initially. There are some thoughts that we could have a worsening risk over time with hormone replacement therapy. The duration of the therapy all depends on your symptom profile, when your symptoms started. We can always stop hormone replacement therapy to see if your symptoms have recurred. The thing about especially hot flashes with menopausal symptoms is that they can last up to a decade for some women. So we can always trial off to see if symptom profiles have improved over time, and we can restart if necessary. But some patients, I have some patients that stay on it pretty consistently and have been on it for over 5 years. And I have some patients that it is, that take it for less time, and then we do trials off. Here's another question. This patient said that they talked to their primary care doctor about hormone replacement therapy at the onset of menopause, and it wasn't very encouraging. Is there benefit to going through AUI versus my primary if he's willing to prescribe it? I'm always happy to talk with patients about options, from a primary perspective versus a urologic perspective. I think that there's a lot of shared decision making to be made there. I do have, because of that Women's Health Initiative study that showed that there was some increased risk of side effect with hormone replacement therapy, there are a lot of doctors and primary care doctors that have really gotten away from prescribing this because of the risk profile, I think there's benefit to coming to a specialist who really can fully evaluate you and make sure you're being monitored appropriately. So I would be happy to talk with you if that's the case. Let's see here. So here's a question about antidepressants, asking if I can comment on antidepressants and sexual response. So antidepressants have kind of a counterintuitive or counterproductive effect sometimes, depending on patient symptom profiles. Some antidepressants will decrease hot flashes, and that's very helpful for some menopausal patients, but it can also decrease libido. So I always talk with patients individually about this and discuss, the benefits and the cons of antidepressant therapy. I have several patients that don't want to jump into the hormone space right away, and if their most common side effect is hot flashes, and if they're not terribly sexually active, or if they're not as concerned about their libido, that certainly can be an appropriate a treatment modality. This patient asked, or this attendee, excuse me, asked, since I'm older, is it natural to have less hormones? Yes, that's exactly what happens to us ladies over time. Our hormones kind of come up, through puberty and through our adulthood. And then as menopause sets in, they drop way, way down. So that is completely normal. The side effects of it are the things that we're trying to mitigate as far as replacement therapy goes. Next question says, I'm 62 and postmenopausal. I've been in menopause since I was 68. Is it too late for me to try hormone replacement? I do not think that's necessarily the case. Of course, we'd have to have a full evaluation of your medical background, other comorbid conditions, and to see if you'd be a good candidate. But I certainly wouldn't rule you out completely just based on age. I don't think that's appropriate. Okay. Well, I want to remind everybody that there will be an email going out with a recording of this session. Thank you so much for attending. I really appreciate the opportunity to talk to you more about this topic, and I would be happy to see you here in the office if you'd like to make an appointment with me for an individualized evaluation and further discussion. If there are any other questions, I'll give you just a minute or two more, and I'd be happy to answer them. Alrighty. Well, I think that will be it for tonight. I hope you all found this informative. I hope you all have happy holidays, a great Thanksgiving, and I look forward to seeing you in the office if you'd like to come talk with me further. Thank you so much.